Hi, my name is Dr. Daniel Santisteban from the University of Miami. I would like to tell you about some of the research that we've done and about an article just published in the Family Process Journal. One of the most interesting findings from many research studies with Hispanic families has to do with acculturation. That is, the process of incorporating the beliefs, customs, and values that are most common in the United States. This body of research shows that as individuals spend more time in the United States, and as they become more highly acculturated, they begin to show increasing mental health symptoms. Adolescents specifically show more drug use and other serious behavior problems. It's not clear why this happens, and in a way it's a paradoxical finding. You might expect that there may be many more symptoms shortly after the immigration process, given the stressors and losses associated with leaving one's country of origin and arriving in an unfamiliar country. A goal of our research is to try to understand why and how this happens, and to look within the family for clues. In the research report published in Family Process, we found an interesting set of relationships that might help shed light on this issue. Our data showed that children who had fewer behavior problems also had parents who were reported to be higher on positive parenting and high involvement parenting, as reported by both parents and children. That part is consistent with previous research. That is, parents with more positive and involved parenting had kids who were more successful. Our next step was to look at how culture-related variables related to those family processes and to child symptoms. When we looked at the culture-related variables, we found that it was those parents who reported being less acculturated and who had a higher family orientation that reported that effective type of parenting. Those with higher acculturation and low family orientation were reported to have less involved and positive parenting and more behavior problems in the children. This set of findings raises questions of whether increasing years in the United States and increasing acculturation somehow leads to a move away from highly positive and involved parenting and toward more child behavior problems. We wonder whether the complex acculturation process leads to breakdowns in what parents believe to be their blueprint for parenting and good family process. We believe that this will be a promising avenue for longitudinal research that can follow changes over time, and research that focuses on the possible protective family processes that might be found in one's culture of origin. If such protective factors can be identified, perhaps we can help families hold on to those things that worked well for them, even as they acculturate.